My name is Dr. Fred Arnold. I'm a naturopathic physician located in Scottsdale, Arizona. Our office is Scottsdale Pain Rehabilitation and Wellness. I'm here today to talk to you about prolotherapy and the hip. The hip is one of the more common conditions that we treat at our office. We utilize prolotherapy to treat painful arthritic hip conditions. The solution that we use in prolotherapy is a mixture of dextrose, lidocaine, and B12. Specific injections are made involving the hip to help the patient reduce their pain as quickly as possible. Some of the more painful conditions that we treat involving the hip are arthritic conditions where there has been a deterioration of the cartilage. The first thing that we want to do on our model is show you exactly what we mean when we're talking about the hip joint. Many people confuse the SI joints or the greater trochanter or some other part of the pelvis with the hip. This is the true hip joint. This is what we treat. This is where the injection has to be made, and very specifically for the job to be done correctly. What I'm showing you here is an actual image of the hip joint with ultrasound visualization. All hip injections that are performed at the office are performed with ultrasound guidance. Basically, we see the ball of the hip joint. On top of this ball, there's this membrane area or tissue that is on top of it, specifically where the needle is to be placed with ultrasound guidance is in this area. That way this solution will bathe into the joint. I'm going to turn this, and you can see on this video basically where the needle is coming down. It's precisely placed beneath the capsular ligament on the ball so that the solution will get into the joint and help regenerate torn cartilage. When you come to our office, I personally meet with you to go over your case history involving your painful hip. I review any studies that have been performed, and we ask that you bring any x-rays or MRI reports. An exam is performed of your painful area to determine exactly the most appropriate treatment involving your painful hip. It should be realized that hips many times are not just the hip joint. It also involves other areas such as the greater trochanter or even the SI joints, sometimes even the lower lumbar spine. All this will be taken into consideration when you come to the office, and we review your history, exam, and reports that you bring. It is my goal to treat you with as few times as possible in the most efficient manner, so we ask that you do bring any studies and information so that we can best help you with your painful condition.